Deborah Smith. Deborah is the executive director of the Essex Library Association. She's going to talk about the importance of having a continuity of operations plan, which is a vital part of any emergency plan. And boy, oh boy, that really is true. So, Deborah, it is all yours.
Thank you. Thank you so much to the organizers for having me here with you today. I know we've had, I'm here towards the end of the day, so it's sort of like the pandemic. It feels like we're in a long stretch. So glad everybody had a chance to get up and walk around. What I'm going to talk about today is specifically the pandemic and how here at Essex Library in Connecticut, we have created a continuity of operations plan, and also how we have worked with our library consortium to make a plan for them as well. So just a little bit about me. I'm the executive director of the Essex Library Association. As a result of that position, I sit on the board of directors and the steering committee for Libraries Online, which is a consortium of many libraries here in the south central part of Connecticut. I came to library science. I had worked in libraries as actually my very first job ever, but then had a long career in education and actually have risk management exposure, which you sort of get as you go along in your career, I feel, from working in a boarding school. So I have experience sort of with everything that was touched on today, not floods, thankfully, not yet, but have had experience with lice and with bed bugs, with the H1N1 swine flu, which was an issue for the school I worked at because we had a number of students from China. So that was a concern for us early on. I also have experience here in Connecticut. We have the 2011 Halloween Northeaster, which is a storm where we had sizable snow. It was sort of the year before we had then a hurricane after that. But in that situation in 2011, we lost power for 11 days up here in Connecticut. And then, of course, also familiar with threats from active shooter situations because we had Sandy Hook here in Connecticut in 2012. So all that has been, unfortunately, good training for me for the pandemic. Just to give you a little bit of sense of the two organizations that I'm representing today, Essex Library Association, I joined last July. So I have now had 1 year as director of the Essex Library. It's been quite a year. We are an association public library. So what that means is most libraries are municipal. So they're getting all their funding from the town. We get 55% funding from our town, 45% is from private sources. So when we're talking about this pandemic, we're also talking about financial impact and financial threat because half of our revenue is from sort of endowment and donations. We are a smaller town, so we have about 6,500 in our service population. We're sort of a rural suburban hybrid. I don't think there's really any place in Connecticut that you could call truly rural just because we're a smaller state. We do have an older patron demographic here in Essex, so that is when you have a pandemic like this, which is disproportionately killing older people, that becomes a concern for us in terms of how we minimize the risk to those patrons in particular. In terms of Lion, we are a member of the Libraries Online Consortium here in Southern Connecticut. There are 4 library consortiums in Connecticut. 37 members are in the Lion Consortium. So mostly what we get through our consortium is we have a shared OPAC. So we use Sierra III, and we also get IT support from Lion. That Lion body is all governed by member directors. So all 37 of us are sitting there on the board of directors making decisions together. When I talk about continuity of operations plan, I want to emphasize mostly that the specifics are always going to change, okay, as you go along. So for example, when we were making our continuity of operations plan back in February, I sort of had, okay, well, maybe we need to plan 2 months out. Here we are 4.5 months ahead, and things have changed dramatically over that time. So the things that you really want to focus on sort of as a director level, you want to focus on communication, you want to focus on flexibility, and then you also have to keep scanning and keep collecting data. So you can't get stuck in any one point in time. We may have written our plan back in February, but it needs to evolve with evolving threat. The other thing about continuity of operations is you're thinking very differently about continuity. What does that mean to your organization? What does it mean to continue operations? Do you need to be sort of fully like you were before pandemic, or do you need to make changes to that and say, you know what, for us, continuity is people are going to work from home, but we're going to go to a hybrid model. So continuity no longer means 47 contact hours a week of having the library open. It means maybe, 30 hours a week, and then the rest is adjusted. Similarly, you also need to think about operations. What constitutes operations for you? Because both of those things, the continuity and the operations, may change along the way. So I'm going to talk to you sort of about 4 things that went into creating our continuity of operations plan, our process. So the first thing was you want to build your own plan. And then if you are a member of a consortium or a group, or you are perhaps a department within a university where you're working with other groups on campus, you want to get your own house in order, and then you can assist others and leverage groupthink at that point. Ongoing, you want to use data and you want to borrow resources. So we had a few presenters who talked about the fact that you actually don't need to do everything from scratch, and you shouldn't. So you should use those resources. You should go to the CDC, to FEMA, to all of the various resources that are out there, both at the federal government level and then also at your state level and your local level. And finally, you need to keep scanning for threats, because we may have started out with a viral threat, but then we actually developed a financial threat. So if we had only focused on one, we would have lost the fact that we needed to also put attention on making sure that the library could continue to pay people along the way. So I'm going to talk first about the first step in our process, which was scanning for threats. So the key thing here is to develop that risk assessment mindset. And I think that there are probably some of us who are natural worrywarts, or also have the exposure that we've gotten through various jobs or personal exposure to sort of risk planning and risk assessment. But one of the things that you need to do if you're sort of in a director's position, or a position where you have responsibility for operational continuity, is to monitor the news daily. And you also want to diversify your sources of that news, so you're not just relying on the phone, which is sort of your cell phone, which is linked into what they know you like from the algorithms. But you want to be looking at lots of different sources. So for example, every morning I'm looking at my local news, I'm looking at the state news, the national news. I actually read a lot of global news, so I'll check to see what's going on in Europe, what's going on in Asia. I'll check newspapers, in Australia, newspapers in Canada, just because I want to see what's important to other folks around the world. We can sometimes in America get very focused on the national conversations and forget to scan on the global level. And this was one case where we needed to have our eyes on the world. So I also look at, I get my news from the print sources, of course, online sources. I also listen to, the TV news at night, and I listen to the radio, NPR, for example, in the car. So it's collection, and that's sort of informal information gathering, but it's all going into the bank of data that you're going to pull from, so that you can then assess whether something is rising in severity in terms of a risk to you and your organization. One of the things you want to do early on is check your insurance, and you can do that now. So if you have insurance for your institution, you need to ask for a risk assessment. They will be happy to do that, because of course they don't want to have to pay out the coverage for you, right? So they want to make sure that your organization is all set and that you have a good grasp of procedures and so forth in place. You also want to digitize key documents. We talked earlier about having things kept on the cloud. I actually, so I did digitize early on our certificate of incorporation, our insurance documents, and kept those backups off-site. But at the same time, I also want to warn against keeping things only in the cloud, because you might have power go out and you'll need actually the print copy. If you can't access it, it doesn't help you. So I actually keep emergency info in both of my cars and at home in print format as well, just so I know that I have that old-fashioned backup. You want to review your mission. So if you go back to your mission for your library or your educational institution, sort of what are you defining within that mission statement as to your essential services? You know, is it that you're going to circulate items? Is it that you're providing internet access or programs or collection development services? So what is it that you actually define as your core mission? And then the other question you need to ask is, who is essential on your staff? You know, who can you not live without? And you're going to train and layer back up in place. And then the other question you have to ask is what's essential to you as a director the same as what's essential to your staff, you know, and your stakeholders? Because it could be very different, and you could get off track thinking that this thing is very important, but then all of a sudden somebody says to you, no, that's actually not as important to our constituency. You also need to communicate what's essential and why to your board and to your patrons. So communication, we've heard that all day long, but very important. And then you do want to layer in redundancy. So when you're thinking about those essential people, you're thinking about the essential tasks, you want to layer in and cross-train for that early, just so when you're in a pandemic situation, you don't suddenly have to say, okay, I need somebody who can, you know, update my website, because if my first person gets ill, I need someone else who's ready to go. So making sure that you cross-train for backup is very important. You also need to think of all of your exposures and in various hats. So in libraries, we tend to focus on our patrons. Of course, that's our main constituency. That's what we're here for. We want to lend books out. But you also have a responsibility for your staff, for your volunteers, any interns, vendors, you know, the UPS guy who comes into your building every day. You have a responsibility to be a safe workplace, I think first and foremost, before you can actually be safe for patrons. So I know you've seen the risk grids with other presenters, but I have one here on this slide, which is a risk assessment table. So you want to think through, you can sort of get these things off the internet and you can fill them in for various risks, but you want to be thinking here, what's, is it length of exposure for any one event? Is it a severity of event? And so we've talked about floods, we've talked about hurricanes, we're talking about pandemic now. So you sort of need to assess what's in the green as being sort of lower risk or lower likelihood, and what's in red, which is immediate attention. So just so you have a sense of this, in January, I began to read reports of coronavirus in China. So that was interesting to me. It was alarming, but in terms of my library in particular, it was low likelihood and low harm. So I would put that as a 1. It was clearly in the green at that point. But by February, the virus had sort of moved. We knew at that point in time that the virus was moving from China to other countries. So it became more in the medium likelihood. So, you know, lower harm still, because it's not quite here in Connecticut, in Essex, but still it's something to monitor. And then by March, the virus was in Connecticut, and we were definitely sort of into that 4 category. So we were in that, you know, higher likelihood, and the severity of harm was ticking up. And now by June, we've had deaths reported here in Essex. For a long time, we didn't have deaths in Essex. We were still at that medium. We were monitoring for the statewide risk, but now I would classify us as being in that high 5 category. So there is a higher likelihood and a higher severity of impact. So what to do when you know you're going to have a problem? You need to build your own plan first. So like they say on the airplane, put your own oxygen mask on first before you assist a child or a neighbor. And part of that is you need to start with your library level planning. So you form a small team, and we've talked about teams earlier today, to assess what we have and what you need. So when I was in this position, I started reading the stories about the pandemic in China. I said, that's interesting. Let's see if we have a continuity of operations plan in place at Essex. I knew we had a disaster plan. And I went to look at it, and we had everything we know. We had the floods covered. We had who to call if the collections were damaged. We had all that information. What we didn't have was, what are we going to do if there's a public health risk? So I started to make our continuity of operations plan. One of the things that you can do is you need to cultivate a threat scanning mindset among staff. And the BBC actually just had a pretty good article about this in terms of There are professionals, and we've had them all here today as well, on how you can prepare for a disaster, but more importantly, how you can think about identifying what might become a problem for your organization. I also have relied a lot in the past several months on a book called Library as Safe Haven, which does tell you how to make a continuity of operations plan. I turned to that chapter first, of course, and their recommendation was that it be 1 page. Well, I thought, okay, I'm a little bit of a list maker. It's hard for me. You know, I need to have sort of a guide that tells me do this, this, this. So our COOP, as I'll call it, is more than 1 page, but it does list our key contacts. So I know, you know, it has all those phone numbers that I need right off. You know, where's our bookkeeper? Okay, because everybody needs to still get paid while you're managing the disaster. So those key contacts are there, but more importantly, it sort of was my best guesstimate for what was going to occur when, and it wasn't tied to actually a time, you know, it's month 1, month 2, it's time to stages. And so I'm sure most states are now doing a phase 1, phase 2, phase 3 kind of reopening plan. So our plan is actually aligned to that kind of terminology. But one of the things that you need to remember is that the most unpredictable part of any disaster is actually human behavior. And we're seeing that now sort of in a national conversation about whether to wear a mask or to not wear a mask in a public health disaster. So human behavior is the one thing that you really can't plan for. You don't know how that's going to play out. You just know that it's going to be there. And that depends a lot on individuals. So people will have different risk tolerances. They will have had different life experiences that affect them. They'll also have different vulnerabilities, you know, different pre-existing health conditions, different fears of illness, and also different stress capacities or tolerances and different family living situations. So all of that is going to impact you. You're just not going to know ahead of time how it's going to play out, but you do need to be prepared for it. So here is our 1 sheet rather than 1 page continuity operations plan. And I'm happy to share this with you. If you'd like to email me afterwards, I'm happy to share you. This is sort of our demo. So it doesn't have, you know, everybody's phone numbers in it, but it does tell you sort of, you know, there's a chain of command is sort of the first thing. Then there's key contacts, and that has, you know, the email address, the phone number for that person. It also has their name. And then it also talks about designated responsibilities. And then we talk about the different phases. So we sort of have the proactive threat assessment stage. Then we move into an emergency closing stage. We talk about communication. We talk about remote operations. And then we talk about facility reopening. So it sort of is nicely tied to go all the way around. We're not really there yet at the end of this plan, but at some point we will be, and that will be a happy day. Then the thing you need to do after you've built your plan, if you are a member of a consortium or any kind of a group, you need to help others. And that is actually helping you as well. I love this part of this slide in particular because this is from our annual report of the Libraries Online Consortium. And you can see that in February 2020, the report, and I quote, "There was a very short discussion on developing continuity plans in the unlikely event libraries might be affected by the ongoing COVID-19 pandemic." And then we turn to March 2020, and it says by mid-March, all libraries were closed to the public indefinitely and were still closed as of early June. And the reason I find this so it's sad, but it's amusing to me is because I was actually the person who initiated that very short discussion back in February. So the question I sort of had was, why was it on my radar and not on others? And I attribute that to the threat scanning that I was doing ahead of time. Anyway, to assist others, you need to raise the warning flag. So by March 6th, Lion had sent out a communication to all of its members which talked about how to create a continuity of operations plan and was collecting people who were, we had a small team that was working to think through what that consortium needed to do for all of the member libraries. Then since that point in time, Lion has been of great benefit to the members because we share info weekly. So we have weekly meetings, a weekly Zoom call. We also are sharing information through Google Docs. So for example, there are certain issues if you're in a consortium where you're a public library and you're open, but your neighbors in the neighboring towns are not open. So what's going to happen in that situation? Your library is going to get flooded with people, and that's not something that you want in a pandemic. So coordination of reopening stages and also of resumption of the interlibrary loan system, that becomes very important. It was also important in our case here in Connecticut to make sure that our consortium had someone at the table on the governor's planning commission about reopening, because we were not included in the phase 1 reopening. So actually libraries didn't know, are we sort of essential? Are we not essential? What do we need to do? Is curbside service okay? Is it not okay? What's the risk and what's the benefit? We then got our representative, the executive director of Lion, then got to the table to represent our consortium in those state level discussions. And what the result was that we now have in our phase 2, which is where we currently are, Connecticut has paused reopening of phase 3 due to the evolving threat in other states. But because we are in phase 2, you can go to the state's reopen plan and you can see that there's actually a dedicated section there on what libraries are supposed to do. So you want to raise the warning, you then want to share info, but you also want to protect the herd. So you need to ID your system-wide vulnerabilities. So we noticed that we needed to turn off patron holds system-wide. We needed to turn off automated renewal notices. We didn't want people getting something in the email that said that their book was available when actually the library was closed. We also decided to coordinate and extend all due dates out, have auto renewals, give fine waivers, issue cards remotely to patrons, because if you were a patron and you needed to use a resource and you hadn't actually come into the library for years, now was a time when you really wanted something at home that was a digital resource for you. And then also we needed to monitor for the ripple effects. So when one library, for example, turned on their holds, the ability for patrons to place a hold on the computer, on the catalog, other libraries became affected. And so there are sometimes unforeseen ripple effects, and that communication helps you to understand who's having a problem where. Finally, I would suggest that you partner with other consortiums. So even though we're a member of Lion, we're actually also a member of the Connecticut Library Consortium, and we benefit from the Community Foundation of Middlesex County, which actually gave us personal protective equipment. So there's lots that don't just stick to one source or resource, but diversify and leverage those resources. So you can see here on the left, this is just a sample of one of the communications that Lion put out so that we knew who was opening for curbside when. So we all had that information. So we knew it was asynchronous, but we also know who was open when. And then this is what I was talking about earlier, was the state plan, which has the information on libraries. Finally, there's another step here, which is using data and borrowing resources. So Connecticut, we're very fortunate to have a lot of information available on the statewide level. And you can see that here I have the website address for our state resources on COVID reopening. So it has all this data. You'll see there's an Excel spreadsheet at the bottom of the screen there. You can look up and see what every library in the state is doing, what services they're offering, and when they're open, when they're doing what. The other thing that we have here is we have this sort of summary at the top, which you can see that as of June 24th, 15% of libraries had opened their buildings to the public. And then a week later, as of July 1, 22% had reopened their buildings to the public. And then just as of this week, 38% had reopened their buildings to the public. Keeping track of this data is important because it tells you what the statewide look is in your area. But it's also important because, as I'll show you in a coming slide, as of July 1, 22% had reopened. So we've now had another 16% of libraries have reopened in the past week, but there's a problem with that. So if you're also keeping your eye on the local situation, you can see here that I get information from the town of Essex, which tells me what the situation is here right in my community. It also then breaks out sort of what the cases have been locally. So you can see that Since January 1st of 2020, there have been a total of 51 cases. It gives a breakdown by male and female, and then it tells you, congregate setting, so that means sort of nursing home, and then non-congregate setting. So the thing that's of concern here is that since July 1, all of the new cases have been in non-congregate settings. So while Essex had a problem early on with nursing homes, we're having a different kind of problem now. Why is that important to me as a library director? Well, I'm going to be sending books to a nursing home sort of through a driver who comes and picks things up once a week, but those folks are really not going to be coming into my facility. But the people who are living in non-congregate settings are certainly going to be coming into the library. So that's now the new risk that I need to manage. And why is that important? Because if we go back here, you would see that as of July 1, 22% had reopened, but then sort of a week later is when we're starting to get the data that cases have been rising. So it's very important to keep your eye on the national stories, but also very much on the local level. This was said earlier that you don't need to, reinvent the wheel. And so this is a communication that Lion sent out early on. This was that March 6th communication to all of our members. And the arrow is just showing you that it says, we have modified it from the American Library Association. So we used sources from different places. You could actually, get continuity of operation plans from many different industries and then borrow what's the best thing for your particular library, but you can then tweak it. So what we did was we looked at consortium needs, what does the consortium need to provide to the libraries, and then what does our library itself need. The next thing to do is to reassess and learn from mistakes. And that can be at the end of the disaster, but it also can be ongoing throughout the disaster. So it's sort of, you need to watch your bloopers, as it were, because in this situation in particular, if one library stumbles, there's a problem sort of for all of the consortium partners. So one of the things we learned is that libraries, when we were closing, it was asynchronous. So we had libraries, and Essex Library closed pretty early. We closed on March 13th, but libraries that closed later than that were hit with an influx of patrons. So patrons would go from one town to another town, because Connecticut is small, you can easily drive to another library. And then they would be in that library at a time when the public health situation was not really very understood. We knew there was a threat, but we were sort of focused on surfaces and that kind of thing. The other thing you need to do is you want to avoid a stampede into your library. So we tied our closure in advance of the school dismissal here in Essex. So we knew Essex was going to close, the schools were going to close at 2 p.m. We closed at 12 p.m. just because we didn't want to have all these kids flooding into the library at the last minute. You'll also know, you'll identify things like what I call the TP problem. We didn't have enough toilet paper on hand. We will not have that problem ever again. We will make sure to order in quantities that we have enough supply, because you don't want to go through a 2-month period where you really can't have your staff in the building because you don't have supplies in the bathroom. And finally, the important thing is to understand that one size doesn't fit all. So libraries in a consortium are going to have different demands. For example, some libraries can't have a separate exit and entrance if you're going to have a flow of public into your building, because you have an ADA compliance issue. You need to make sure that you have wheelchair accessibility, and you may only have one entrance that has that. The other thing is, you may not have sufficient bathrooms to have bathrooms that can be cleaned every day for both staff and patrons. And also you have different service populations. So one town may be very heavy on services to children. Another town like my town may be more heavy on services to the elderly. So there needs to be some flexibility in that in terms of what the consortium can support. So this is my final slide here, just to let you know in terms of what the takeaways have been so far for Lion throughout this pandemic. And again, it is a work in progress. We are not at phase 3 yet, and I don't anticipate that my library will have the public in it until we're at phase 5. So we still have a long way to go. But Lion has some of the things that have benefited our members are with standardized weekly meetings. So we meet every Monday. We also Lion has coordinated the back office actions for us. So if they need to send out something that says due dates are extended, or card expirations. Anybody who had a card that was going to expire before June 30th, well, now you have until December 31st to do that. So they're able to do all of that on our behalf. There's also, they're coordinating consortia-wide messaging. So if you go onto our catalog, you will often see a message which goes out for all of our member libraries. So there's sort of unified response there. And then finally, they did a great job on coordinating IT responses for the various libraries and helping us to move computers around. For example, you don't want to have all of your patrons sitting in one area next to each other when you do reopen. So they were able to get our IT staff into each library, all of those 30 plus members, to help us get some social distancing in place for that. So I know that I've covered a lot of ground here, but that's my email address. If you have questions for me, I'd be happy to answer them for you later. It looks like I am over time. I apologize for that. So I'm going to stop screen sharing now.